Hi everybody, Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick.
And today we are going to talk about cardiovascular disease and COVID.
But a couple things before we get started. A couple very important things. One, most important, it is Dr. Ostick's birthday today. So happy birthday to Dr. Amy Ostick. We're
Thank
excited
you.
to celebrate this birthday weekend. Secondly, if you can, please smash the like button. Please subscribe to the channel. Please turn on your notifications so you can be notified of every one of these. Like and share it if you're on Facebook. Share it with your friends, your
Yes.
coworkers. Let's get this message out. It helps to get the information to people and helps us get more visibility as a business. So please take some time. Oh, and if you can write a recommendation, 5-star recommendation, go ahead and write it. We appreciate it. Thank you. It helps us, helps get the message out.
So, cardiovascular disease, February is Heart Health Awareness Month. And a lot of what I do here in primary care is cardiovascular disease education, screening, prevention, treatment. And I thought it would be a really nice topic to discuss how that plays a role into COVID-19. A large majority of patients that get sick and very sick with COVID in the hospital have underlying cardiovascular complications or diseases, hypertension, coronary artery disease. And so a lot of those cases, they say up to a third of people with hypertension don't know it, right? They're walking around with that diagnosis unaware. So what I have a sense is that even though your loved one may have entered the ER with COVID thinking that they were healthy with no issues, maybe they did have this underlying diagnosis of hypertension or undiagnosed or uncontrolled, and then that set them up to be a higher risk patient to get complications from COVID-19. So, in the ER, in the ICU, what are some of the risks with COVID-19 patients for cardiovascular wise?
Well, I mean, we've seen patients with heart attacks, with blood clots has been a big one since COVID started. So for whatever reason, the infection seems to make people's blood clot easier. So people end up with DVTs, which are deep venous thrombosis, or blood clots in the legs, which can then lead to PEs, which are pulmonary embolism, which is a blood clot in the lungs. And that can be very dangerous and sometimes even life-threatening.
Right, so people are being treated in the ER and also in the inpatient setting with therapeutic blood thinners, something called Lovenox. That was something they started kind of, I feel like, earlier on in the pandemic and realized that this was more than just a pulmonary respiratory disease and that there was a vascular component to this as well.
Right.
In the outpatient setting, a lot of what I do when I recommend patients when they have COVID-19 obviously is monitoring their blood oxygen levels through a pulse oximeter and making sure their symptoms are mild and watching them and making sure that they recover okay. But also, if they are of higher risk category, they're older or they have an underlying cardiovascular health problem like hypertension, I will recommend either low dose or therapeutic dose aspirin, so either 81 or 325 aspirin, baby aspirin, as sort of a mild blood thinner to also hopefully prevent heart attack and stroke while they're having they're going through their COVID-19 infection.
Got it.
Just in this week, I've had 4 male patients of mine walking in unaware of their hypertension diagnoses, young, seemingly healthy patients. So it is very important more than anything right now, especially as our numbers are going down, to get screened, to get your annual physical. And you may feel fine and think you're fine, but certainly as we get older, we know that genetic predisposition or other lifestyle choices, whatever it is, may set you up to having higher blood pressures. And those higher blood pressures may go undiagnosed for years, but do put you in a higher risk category for complications with COVID. So getting screened, seeing your primary doctor to get that checked and to get on the appropriate medication so that you can be under control.
And if you see me in the ER for your heart attack or your stroke, it's probably too late.
Yeah,
Get your
absolutely.
screening done and take care of your high blood pressure with your primary doctor before it ever becomes a serious issue.
Yes, so getting your physical exam, Again, hypertension is a symptomless disease usually, right?
Right.
So they that's what they call it, the silent killer. So you can walk around in that abnormal range for years. So getting in there just to get screened, getting lipids checked, getting your blood sugar checked, all those things are really important to give us an idea of where you are with your cardiovascular health. Because as we get older, that risk starts to go up just endogenously of being older, but also other risk factors, like I said, genetics play a role, what you're eating, lifestyle plays a role. So having those conversations to optimize your cardiovascular health so that A, you have a reduced risk of stroke and heart attack later on in life, but also that if you do get COVID-19, you don't have these complications.
Right. Take care of your heart. You only get one, usually, unless you get a transplant. But
Yes.
one heart.
Take care of your heart for sure. This is
Yeah.
Heart Health Awareness Month. And get the vaccine when you can. All right. This vaccine has proven efficacy and safety profiles with it. We need to get this expeditiously out so that we can avoid these newer strains becoming more predominant in our communities, thus possibly affecting the vaccine efficacy. So when it is your time, get it, be on it. If you're over 65 and you're having a hard time getting an appointment, call your granddaughter, your grandson, your niece, or your nephew. Call somebody that can help you navigate that system. If you're my patient, call me, or I've already made the appointment for you.
Right.
Most likely.
If you want to become a patient, check out www.healthandhealingdpc.com to
Yes.
find the information. www.healthandhealingdpc.com dpc.com/sign-up is the way you sign up for the practice, or just call 818-600-2426. You can speak to Ana Maria or Paula, our new MA.
Yeah, habla español.
Yes.
Yes.
They're both, or if you speak Hungarian, you
Or
can
Hungarian.
speak to Ana Maria. So,
Yes.
and if you speak English, you can speak to
Any
any
of
of
them.
them.
We love you guys so much. Take care of yourselves. We're almost to the end. Our numbers are going down. Schools are going back in session in a couple weeks. All right. Have a wonderful weekend.